my name's Rachel. I'm going to be your nurse today. What is your name?
Daniel.
And how old are you?
17.
Okay, Daniel, today you're in for a head-to-toe assessment. But first I'm going to ask you just a few questions. Do you know who the current president of the United States is?
Trump.
And do you know where you are right now?
In my home.
Alright, and your hygiene looks like it's nice and clean. Doesn't look like you have any issues there. Do you shower every day pretty much?
Yeah.
And do you have access to 3 meals a day every day?
Yep.
Okay, and I noticed when you walked in, you had a good gait. It looks like you walked in, you didn't have any mobility issues. Do you use any assistive devices such as a cane or a walker?
No.
Okay, and do you have dentures or hearing aids?
No.
Okay, your posture looks really good. You look straight and nice, so nothing wrong there. And is English your native language?
Yeah, it is.
Okay, and your mood from day to day, are you generally happy?
Yeah, I am.
Okay, and lastly, I noticed your BMI is within normal range of your height and weight. So that looks good, and now we'll start with your head-to-toe assessment. Thank you. My name is Rachel. I'm going to be doing a head-to-toe assessment report on a 17-year-old male who came in today just for a head-to-toe assessment. I first started out with some general orientation questions. He was alert and oriented ×3. He knew who the president was, he knew where he was, and he knew what was going on and why he was having an assessment. He had a great nutritional status. He had access to 3 meals a day, every single day. He had good hygiene. Looks like he stated that he showers every day, and he had a great hygiene. His BMI was appropriate for his height. It was within normal range, and his posture was nice and straight, and it was good. It looked like when he walked in, he had great mobility, no issues with his gait. He denied having any assistive devices. And his native language is English. He had great speech. He was very legible. I understood everything he was saying. His mood is generally good. He said he's happy every day pretty much. No issues with that. And that's what I ended with on questions. I then moved on to assessing his skin. His skin was nice and warm, and his hair distribution looked good. He didn't have any visible lesions on his skin. His color was appropriate for his race. His nail beds were nice and clean, and his capillary refill was less than 1 second. His peripheral pulses of his upper extremities were palpable and equal bilaterally, which was his radial and brachial pulses. They were both really good. Next, I moved on to his head. His scalp was round. There were no indentions or anything. He didn't have any lesions, tenderness, bruises. His hair was brown and it was clean. He had no complaints there, no pain. So then I moved on to his face. He had, his facial features were symmetrical. His eyebrows, eyes, nose, mouth, ears, all of those were nice and symmetrical. Cranial nerves 1 through 12 were all intact. And after that, we moved on and I assessed his neck. Cranial nerve number 11, which was spinal accessory, was intact. He had full range of motion of his neck, and he had no tenderness. His trachea was nice and midline. He had no swelling of his thyroid. His lymph nodes were not swollen. He had no pain, so nothing was wrong there, and he had no complaints. So then I moved on to assessing his eyes. His eyes they had no drainage, they had no lesions. His conjunctiva was nice and pink and moist. There was no dryness. He had no pain. His pupil reaction was equal, round, reactive to light, and he did have accommodation. His irises were brown. His cornea was nice and round. It was not concave in any way, and it looked really good. He had no issues with his vision. Everything was intact and good. So next we moved on to his nose, and his nasal mucosa were nice and pink. He had no drainage. His patency of his nares were both equal, patent bilaterally. He had no drainage. He could breathe out of both without any problems. So that was good. He was able to smell, which was cranial nerve number 1. And then we moved on and I assessed his ears. He had no drainage, no pain during my assessment, and no pain with hearing. So then I moved on to his mouth. His lips were dry and intact. He had no cracked lips. They were nice and pink and intact, like I said. So then I asked him to open his mouth. His buccal mucosa was nice and pink and moist. His teeth looked good. They were not cracked. His tongue looked good. No lesions. It was nice and pink and moist. His tonsils looked good. There was no swelling, no drainage. And his hard and soft palate were nice and moist. Nothing was wrong there. And he had no complaints in his mouth and no pain. After we did that, I moved on to listening to his lungs, auscultating his lungs and checking that out. I assessed his anterior and posterior chest. His AP to T diameter was 2:1, and his breathing was non-labored. His respirations were 15. He had no accessory muscle use with his breaths, and his lungs were clear and equal bilaterally, and he had no complaints or any issue with that. I then moved on to listening to his heart sounds. I assessed him sitting and lying down. He had no murmurs, no thrills. His heart rate was regular rhythm, even. It was a rate of 78. S1 and S2 were noted. I did assess his apical pulse, which is in the space of the fifth intercostal space, the left midclavicular line, which is also known as the mitral valve apical pulse. After that, I moved on to assessing his abdomen. I looked at it eye level. His contour was good. It was nice and flat. His color was appropriate for his race. And before I started messing with him, we did the auscultation. And he had bowel sounds in all 4 quadrants. He was negative to any tenderness during my palpation of his quadrants. He had no pain. He was negative for Murphy's, negative for any pain or tenderness. He had no complaints there. Next, I moved on and I assessed him for CVA tenderness. He was negative for that, and that looked good there. He had no complaints. Finally, we moved on to his lower extremities. His lower extremities were nice and symmetrical. His skin looked good. It was appropriate for his race. He had good hair distribution. There were no missing hair. It was nice and evenly distributed. No patches were missing. And there were no visible varicose veins, and he was negative for any peripheral edema on his lower extremities. He had full range of motion of his lower extremities and his upper extremities, and his muscle strength was very good in his lower extremities and his upper extremities. He was negative for the Babinski reflex. He was negative for Romberg test. He was negative for the heel to shin neuro test. He was positive for the patellar reflex, and he was negative for the scoliosis screening. And that concluded our head to toe assessment. Thank you so much.